Hi everyone, welcome to the Lungleng Show. Today, let's talk about back pain again. I have brought one of my guests who came on the show last time, and we talked about back pain, spine surgery, and the details of it. I think this kind of show and conversation is very educative, and I think this will help a lot of people. So we felt the need to do this again, and I'm sure we'll have a wonderful time to specifically talk about back pain. And I can see that many people are suffering from back pain, and this back pain is a very common pain for a lot of people. So as someone who is specialized in spine surgery, as an orthopedic spine surgeon from Apollo Hospital who has worked for more than 22 years and have conducted about 21,000 minor and major surgeries, it will be another wonderful moment insightful moment to talk about this back pain. So Mr. Dr. Joydeep, thanks for coming again, and let's talk about this back pain again.
Thank you again for inviting me. So now, because of the lot of queries I found there in our previous podcast, so we'd like to take it as a mini series, 3. So now back pain.
Yep.
Everyone suffers from it.
Yep.
And not all back pain are bad. Some back pain could be bad.
What do you mean not all back pains are bad?
Means most of the back pains occur frequently.
Okay.
Every 2 or 3 months, and they don't lead to a major problem. But there are certain back pains that one should take note of.
Yeah.
One other thing is that if the back pain is very prolonged. Number 2, if the back pain is associated with fever, where the patient is unable to walk.
Correct.
And if the pain is prolonged and unrelenting, that if you had back pain one day, the other day you are okay, that's okay. But for say 1 month or 2 months you are having back pain, those are called red flags. So these red flags you should take up carefully. For other back pain, generally it is not that bad. So everyone suffers from it, even I, and I think you also suffer from it. At some point of the time, it's like common cold or cough. Everybody has it at some point. But it doesn't usually cause a lot of a problem.
Right. You mean to say it's very normal, right?
It's very normal.
Since you have a body, you have a bone, so like the back will always be,
yes.
There will be pain in one way or the other.
So coming to back pain is that back is your part in the spine.
Yeah.
So the back pain could arise from the spine itself, or from surrounding muscles. Sometimes you have some problems in your gut, in your abdomen, like kidney problems, that can also give rise to back pain rarely. So mainly it's due to the spine, the bones and the tissues in the spine, the bones and disc in between the bones. That can be a pain generator. That means that can cause the pain and you can have pain.
So is that because of the lack of exercise or lack of physical activity that people normally, is it hereditary also?
Yes, there are things like if you you're very sedentary, like people who use the computer a lot, or sit and slouch, they could have more of back pain. If a person is too obese or too thin, they are going to have back pain more than enough. And there are certain things, genetic causes also that lead to back pain.
Right.
So it's a back pain is actually a price we pay being standing on 2 feet. Because if you are a quadruped, like a horse or a cattle, you wouldn't have that much of back pain.
Because they bend naturally.
They bend naturally. And from that position, you have come to this position of standing. And so it takes more stress on the back. So it happens.
That's very interesting. So what would be the way to avert and avoid this kind of pain? I mean, if I don't have a back pain right now,
first and foremost is you have to understand your back. Means some people have some problem in doing certain things, like stooping forward. So you should be avoiding those. And then sitting not more than 1 hour at a time, standing not more than 1 hour at a time, as far as possible within general limits. And then one should take regular rest, exercises, etc., and take adequate nutrition. So these are generally prevent the back pain. Another thing is means your workplace, how it is, how is your chair, those things. Then how is your bed, and sometimes you can adjust your pillow, you can reduce or increase its height, it depends upon your spine, your geometry of your spine.
Right.
So it might not be the same for everyone.
Correct.
It could be different for different people.
So as per your experience, what is the most severe nature of back pain from the patients that had visited you? Like, can you explain to me?
Today itself,
you came for surgery, right?
I came for surgery. I won't disclose the patient details, but it was a case of cancer on the kidney, and it has spread to the bones. Now, with that spread, the patient, the bones at two places were completely destroyed, and the patient was unable to walk or sit. Because if he would walk or sit, the bone would collapse, whatever the weak bones, and they would start hitting on the nerves, and then he would have severe shooting pain from the legs, etc. So he was kind of bed bound, and that we had to do a surgery. So that's the kind of pain where it is very severe, and we should be careful. That I was talking about red flags.
Okay.
Pain with severe pain due to cancer, pain due to infection like tuberculosis. These are the things. So not all back pain are very simple. Sometimes it could be complex.
Yeah.
So you should visit your local doctor, etc. If it is prolonging for more than 3 weeks, 4 weeks.
Okay, so as per your today's experience, like how long did it take for you to complete that?
Actually, the preparation time is around 1.5 hours, and the surgery took place for around 3 hours. And therein we used the modern technique that is known as minimally invasive spine surgery technique, where we use very small incisions to put in the screw. On the screw, we put in bone cement so that the screw won't back out. And this was added with a vertebroplasty procedure, wherein we put with pinhole incisions. We put a needle, and into the body of the vertebra, we put cement, so that it becomes stable enough to take the weight of the patient.
You mean cement?
Yes, this cement is not
construction cement.
The construction cement is a bone cement.
Okay.
It is like a plastic cement. So if you apply it, it gets solidified within say 15 minutes.
Oh.
So and then it has a property of releasing heat. So that is also beneficial, because if there are tumor tissues, they burn the tumor tissues.
Okay.
So.
Wow. So this kind of cases are rare, or is it like very common?
It is not that rare. Nowadays we are getting more and more patients in an advanced stage because of better treatment in cancer. So there are more patients, and we are treating, and advances in implants and the technologies have taken place to render that we can do it.
So as per your experience, did you see the pattern of back pain increasing in people's lives because we are more into sedentary works nowadays?
I won't say that way, but perhaps now the patients are much more aware, and they don't keep sitting at home. They come, take the opinion of a doctor.
Right.
All those things, these things have improved. You have MRIs, X-rays, CT scans everywhere. A lot of doctors everywhere, so they don't take it lying down. Yes, things like cancer has perhaps increased a little bit. And perhaps it's because they are more surviving because of better treatment. So get more of things like cancer in the spine, etc.
Last time you mentioned that it's always recommended not to do surgery if it is not necessary.
Definitely, this is what you are hearing from a spine surgeon.
Right.
I do spine surgery for living, but if it can be avoided, never do spine surgery. If it's a problem that can be treated with surgery, then go for it.
Can you give me an example of which is the kind of like back pain or back problem where it's important?
I will like to give the example of slip disc. Very common.
Okay.
A lot of people have it. Okay, but slip disc generally gets okay by around 6 weeks to 8 weeks in almost 70 to 80% people.
Okay.
So if there is a slip disc, it's causing some pain, but it's not much pain, that's never an indication to go for surgery in the initial phase.
Okay.
So if one has a diagnosis of slip disc, should take care, not rush into surgery. There are 3 conditions where surgery is done in slip disc. One is, if the slip disc, the pain is very severe.
Okay.
And it is not getting okay by 2-3 days.
Yeah.
Number 2, if it is associated weakness of the paralysis of the lower limbs, could be partial paralysis. He cannot lift his foot, or he cannot kind of stand from sitting position.
Yeah.
Or there is an involvement in passing urine and stools, like the stool he cannot control.
Yeah.
Urine dribbles, he cannot hold it. Those are the case. And thirdly is that if someone wants surgery for some, say, there is a kind of wedding in his family, he wants to get better quickly, those are the cases.
Okay, surgery is something like a short, I mean, very quick solution.
Could be a quick solution,
Yeah.
but sometimes surgery could also be like opening a Pandora's box.
Yeah, correct.
Okay, sometimes one thing leads to other things leads to other.
Wow.
So that is the reason why I tell don't go for surgery initially. If you have time, if your pain is bearable, don't go for surgery initially. The body adjusts, takes away a little bit of disc, etc. Reduces the pain by itself. That's the way. Sometimes it doesn't occur, then you have other options. But never initially go for surgery.
I think what brings credibility in your work is, like you said, you earn your living through surgery. You are asking people, recommending people not to do surgery unless
not
it's
to
necessary.
do surgery in the initial phase.
Yeah,
there could be that is what I am trying to educate people, that you have a disc and MRI, don't rush to surgery. Wait. These are the causes where you need surgery. If your pain is manageable, if you don't have weakness, it's just 2 or 3 weeks, just wait. Do some physiotherapy, take some medicines. 70 to 80% pain, 70 to 80% times your pain will go away. Then why go for surgery?
Right. Wow.
Surgery is not only the cost and the risk. There are other things like whenever we do a surgery of the disc, it leads to some collapse of the disc space. The disc becomes thinned out.
Okay.
So there are a lot of things. There could be a problem in the adjacent level. So you have done a disc at say L4-5, you could have problem at the L3-4. And there are other things that can, sometimes there could be infection. So surgery can be done with all the risks, can be done, if only it is necessary. If it's necessary, then also I think people should not avoid surgery, then go for surgery. But what I told, 70 to 80% slip disc patients get better.
Did you have a case where the patient would be very, very young, let's say even 10 below, and have back pain?
Yes.
What does that kind of back pain come from? Where does it come from?
See, there are a lot of causes for this back pain in young children.
Right.
Because, that is what I think we had discussed a little bit back. So, see, in case of children, we are a bit more careful than in case of adults. And if it's back pain is for a long period. So, what could be the causes of the back pain? Sometimes they have some kind of deformity in the spine. There's a kyphosis or scoliosis. There could be one of those causes. Sometimes there could be some problem in the spinal cord itself. Like the spinal cord might be duplicated. Or there's thickening of some spinal cord elements known as thickened phylum terminal, etc. This could be rare causes. Other causes, very severe pain in case of children, could be your limbal fracture and disc prolapse. What is this? Is that, you see, in growing child, you have bone and you have cartilage, because that keeps on going. Sometimes there is a disc, slip disc. It comes with the disc and also the cartilage element. Now, when this cartilage element comes out and now it hits on the nerves, it causes unrelenting pain. And on top of it, if the cartilage is connected to the rest of the tissue, that disc or metal starts to grow. So those things don't get okay by just conservative treatment. That means they might require surgery.
Oh, okay, that's okay. So normally that means when a person grows older, the back pain is, I think, more common, right?
Yes.
Yeah.
Actually, it is like that from 20 to 40, back pain increases.
Mm-hmm.
From 40 to 60, it plateaus down. 60 again, it increases.
I see. Why is that? Like, why does it go down like from 40 to
It
60?
goes down because, see, when the patients are young, they're more active.
Yeah.
So they create more demand on the spine.
Right.
So they have more back pain. Now, once they are middle-aged, what happens? The body tries to contain those problems by fusing, decreasing. There are certain mechanisms body tries to heal itself.
Mm-hmm.
So then the back pain goes away for time being, and also the demand also goes down. After say 60, there are a lot of osteoporosis. The bones become weak, and there are more degeneration. Then they start again having back pain.
I think I'm not a back pain patient, but sometimes I feel that because when I sit to like a prolonged sitting in the on the chair, you feel the back, like your back hurting, and the pain is like inexpressible. It's just too painful sometimes. So, but mine is not like that serious case. But yeah, when I sit for too long, sometimes that occurs. Not every time. So I can understand what back pain means, for people who are going through that.
Yes.
Yeah.
So what is the solution?
So, like you say, don't sit more than for 1 hour.
Don't sit more than 1 hour.
Exactly.
Just get up from your chair, walk about a little bit,
Yeah.
take a glass of water, and then sit down.
Okay. Do you do the same thing?
Yes, I have to do the same thing, but sometimes I don't get that much freedom also.
Right. Oh, I think this is helpful for people who are not aware of it, And when we have back pain, all we could think of is a doctor. See a doctor and, listen to them. But I think before seeing a doctor also, you have your own responsibility.
Yes, you do self-healing that way.
Correct.
And nowadays also ours means if you keep these things, and some people might be trying to know what are the surgeries involved in back pain.
Yeah, please.
So nowadays we do endoscopic spine surgery. That is a keyhole spine surgery. We put very small incisions, unlike they do laparoscopic gallbladder removal. That way we put very thin incisions, go into that part, see with the telescope whatever is wrong, and repair that part. Say if it's a disc prolapse, we just remove it. If it's a fracture, etc., we try to release the nerves and then put screws. So that thing. So like in today's case, we use special screws. They're a bit costly, and with bone cement, and then we could do whatever. But problem in cancer patients, and particularly those who have kidney cancer, they bleed a lot. So means sometimes it's not controllable.
Bleed but there's no open cut, right?
No, if you cut it.
Yeah.
If you cut it, do the traditional surgery, the way it is done traditional.
Okay, they start bleeding.
They start bleeding a lot because those things are very vascular.
Okay.
So with this technique, we didn't cut open completely and put this stab incisions and put the screws.
Wow.
That way the bleeding was very less. It could be around 50 to 60 ml. Okay. If it was done open surgery, the bleeding could be around, say, 1 liter. That's a lot.
So, that means you're saying that there is solution to every problem, at least, right?
At least we are the doctors everywhere are trying to give better solutions.
Correct.
So it might not be that bleak, and every day newer things are coming out. Every day people are finding out newer treatment modalities. So though they are a bit costly, the reach is initially very limited, but slowly those technologies are coming into northeast, and we could do the same here in Kohima with all the equipment bought from outside. But it's slowly these things are getting better, and definitely there is a chance. So rather than lose your hope, contact a doctor and see there might be something more, like a cancer patient with back pain.
Right.
There could be something more we can offer you.
Wow. So how do you ascertain that this is problem of this cause of this back pain is actually something else.
Yes.
Ascertaining is very important, right?
That's a very, very pertinent question you have asked. Back pain can be caused by everything, and there means you might be thinking this is the cause of back pain, and you are treating that, but the cause might be somewhere else, and your treatment will fail.
Correct.
So that thing, first of all, is a very good history taking. From the history, we come to understand from where is the back pain. Second thing is that proper examination of the patient, that we touch and see where it could be the pain coming from. Third thing is the investigations. So from this new modern investigations like CT scan, X-ray, MRI, and then also PET CT scan.
Okay.
We try to localize where is the pain. So on everything we come together to give us a impression of pain. Sometimes there are 3 or 4 discs, slip discs. Now we know that someone is causing problem. Now which one is causing problem? Which one is causing? So we can give a diagnostic block. That is, we give a very thin needle into the near the nerve, place it there, put some medicines, and if your pain goes away, that means that was the cause of the pain.
Wow.
And if the pain doesn't go away, that means that was not the cause of the pain.
Okay.
From there, these are called known as diagnostic blocks. From there, we get a strong idea that this is your problem, and there we have to do a pinpoint treatment for that purpose, and we'll get the result.
That's wonderful. Yeah, objectively diagnosing it first matters a lot, right? And I'm sure you are, I don't have to say anything that to you because you're the professional in that area. So I think this back pain can be, you're giving a message to me. I'm getting a feeling that this is not a very, very dangerous kind of a pain that we can have, but it's, if we take care of it, it can be cured, or
yes,
if we do surgery, it can be cured. Like changing our lifestyle matters for this, right? Yeah. So I think this back pain, eventually almost all of us have to go through this pain.
Yes, eventually it's like common cold or fever. Everyone will have it. Someone will have it more frequently. Someone will have less frequently. This is a common back pain. And
Correct.
there are special back pains where you have to understand that this is not okay. You will understand by yourself the pain that has been lasting for, say, 3 months. The pain that is not allowing one to sleep.
True.
For 3 long months.
Yeah.
Those are the cases where we have to be careful.
So this has been wonderful. Thank you so much
Thank
for
you.
enlightening us with these insights. Yeah. Thank you.